Good morning, Bryan Nehman here with you on WBAL NewsRadio 1090. 'Tis the season for sickness. We know that. It's been a terrible flu season so far across the country. So what can you do to prevent germs spreading within your own home especially? Joining me now is Dr. Robin Motter-Mast. She's the medical director of GBMC, the primary care group. Great to have you on. Appreciate you coming on the show.
Hi, Brian. Good morning. Thanks for having me.
All right. So what's the first thing you should do to try and prevent illness from spreading, especially inside your home?
Well, there are definitely everyday preventative actions that you can do to try to stop colds and flus. So one of the first things you can do is try to avoid close contact with sick people. And if you're in your home, that can be a little difficult. Or if you're at work sitting next to somebody who's sick, that's also challenging. So some of the things that you can think about doing for that would be to change your location. So if you're at work and you're sitting close to somebody, if that person or yourself could find, a little bit of distance between each other to work from, that would be great. If you're at home, you might want to think about, is there a different location that maybe that person can spend the majority of their time? So is there, a bedroom that they could really kind of stay in? Is there a bathroom that maybe they could just use and the rest of the family doesn't need to use? So that would be one of the recommendations. Just really separate yourself. When you're thinking about separating yourself, think about, do you have a fever? So if you've had a fever, you really should try to avoid contact with other people as much as you can for at least 24 hours after the fever has gone.
Okay. So a quarantine area is good. A quarantine couch or a quarantine room. We have a sick couch in our house. I don't know if it works or not because it's in the family room. But let me ask you mentioned a good point about the fever. All right. So if you have a fever, you're obviously contagious. But when are you officially contagious, and how long does it last, especially with the common cold? I mean, when do I know that, is it day 4, day 5 of when my kid's got, the crud of when, okay, well, maybe he's not contagious for the rest of the family or for me?
So as long as somebody is coughing and sneezing, they're contagious. So these type of illnesses are caused by the spread of respiratory droplets. So if somebody is coughing and sneezing, there's potentially viral particles in those respiratory droplets that are being spread. The highest period of being contagious is when you're having that fever. So your body is reacting to that virus, and it's really doing a good job at trying to fight it off when you have a fever. So you know that there's a high level of viral load that those people are carrying. So bottom line is you're highly contagious for 24 hours until 24 hours after your fever has gone away.
All right. We're talking with Dr. Robin Motter-Mast, medical director of GBMC. When you get a common cold, though, sometimes you don't get a fever. So does that make a difference?
Not really. Of course, we worry more about the flu than we do common cold.
Right.
So we call them a common cold because it's relatively common and usually not life-threatening. But once again, anytime if you're coughing or sneezing, you're spreading potential viruses.
Okay. Now, when you do have the flu, you are contagious even after the fever breaks, or are you no longer contagious after that point?
You're contagious, but at a lower level.
Okay.
So, again, they're most contagious during that period of having the fever and 24 hours after the fever goes away.
All right. I'm a big fan of wiping everything down, right? We have shared computers here at WBAL, and I love Stacy Lynn, and I share a computer with her. She's great. She does not have cooties, but I wipe it down every single morning. Lysol wipes. Is that effective, number one, and is that something we should all do on a regular basis, especially in the work environment?
It's absolutely effective, and that's a great idea. So one of those things you do want to think about disinfecting is not just your keyboard, but also your telephone that you're using, any writing utensil that you might be using at work. When you're at home, think about the door handles, especially on the bathrooms that people are using, the light switches, the faucets that people touch, the toilet handles. So all those things that are frequently touched, think about using those disinfectant wipes.
All right. What about hand sanitizer? Is it as effective as washing your hands? I mean, if I just, squirt a little bit on my hands, is that just as good as going to the bathroom and washing my hands?
It is not. It is definitely, the second choice, but the first choice would be to wash your hands. So go use some soap and some warm water and wash your hands. That is the single most best thing that you can do to try to prevent colds and flu.
All right, very good. Has it been as bad, the flu season, as it's been reported in the media? I mean, is that what you're seeing at GBMC?
It has been a bad season. So we have a lot of people who are coming in, and they have either a cold or a flu. So it seems like, families are going down almost at 100%. Usually somewhere 50 to 75% of a household is getting the same illness that somebody is bringing home.
All right, good stuff. Dr. Robin Motter-Mast, Medical Director, GBMC Primary Care Group. Pleasure to have you on. Thank you so much.
Thanks a lot, Brian.